Welcome back to Primetime News. A special welcome to those of you watching on onespotmedia.com. Jamaica now has 26 cases of the coronavirus. That was revealed at a Ministry of Health press conference a short while ago. Now, Vashon Brown was listening in and now joins us live. Vashon, what's the latest?
All right, thank you so much, Herman. So you will recall that yesterday we had 25 cases of the coronavirus. Today, the health minister said it has received another positive result. That now means that there are 26 confirmed cases of COVID-19 in Jamaica.
Of this 26, 17 are imported cases, 8 are import-related cases, and 1 is still under investigation. The new case is a 70-year-old male from Clarendon who is a son-in-law of the one person who was deceased from COVID-19 to date here in Jamaica. This person has no travel history and is linked, of course, to the individual who passed.
Now, at the last press conference on Monday, the health minister said about 600 rooms were needed based on the projections for community spread.
Had a number of offers. The suitability, however, of those facilities in a number of cases are a challenge. Either they are too small, or in some instances, the costs are prohibitive or are high based on the private provider's requirement. And so the search continues. In 1 or 2 cases, we think they are appropriate and discussions are taking place. We are going to have to hopefully collaborate and get the willingness of those players to work with us in the public's interest, in the interest of all of us. And at the very last resort, if we're not getting that cooperation, then there's always the possibility of triggering the law under the emergency powers that exist under these conditions in the national interest to dictate a position that would see us having possession of some of these properties. I mean, that's not what we would like to do. There would have to be fair exchange in terms of market value if it were to come to that. But at the end of the day, we have to find the right blend and the right mix in order to deal with the cases that are likely to come from community spread.
Now, another topical issue relates to Jamaica's testing regime. The Ministry of Health says it tests those who come in contact with people with the virus and show symptoms, among other categories of people. But one recurring question, why not test people who are also asymptomatic, especially with the World Health Organization urging countries to ramp up testing?
Testing of persons when they are without symptoms can result in a negative test, even if they are incubating the virus. This gives a false sense of security and cannot replace the 14-day quarantine period. As the persons are being quarantined, then in terms of testing them, as soon as the symptoms develop, then we test them. The timing of testing at symptom onset is to allow for the best pickup for the virus.
Now, that, of course, was the Chief Medical Officer, Dr. Jacqueline Bisesa Mackenzie. Now, in the meantime, the Bull Bay quarantine zone should be discontinued on Saturday. The health minister continues to insist that the ministry made the right decision based on the community's link to patient 1, the first person that was confirmed with the coronavirus. So what happens next?
In the next few days, 2 to 3 days, the Public Health Department would be ensuring that they do final checks on the persons that would have been identified as close contacts or casual contacts to make sure that they have not developed any symptoms. Anybody that would have developed symptoms would have to be treated differently. So while it is that we do end the quarantine period on Saturday, if there are persons who would have developed symptoms, then around that person, there may be different arrangements that would be made.
And Herman, of course, will continue to track these developments and update members of the public.
All right, thank you very much, Vashon Brown, with the latest from today's press briefing from the Ministry of Health. Janella?